Are you wasting your time with IVF? Hi, I'm Dr. Samantha. I'm a naturopathic doctor that specializes in hormone health and fertility care, and today we're going to talk about IVF clinics. Hi, welcome back to my channel. Before we begin, please don't forget to hit that subscribe button. We come out with a new video every single Friday, and we'd love to have you here with us. Okay, let's get into it. Now, when I first started this video, are you wasting your time with IVF is a little intense, but context applies greatly here. So let's add context. What do I mean? Is going the IVF route a mistake? Well, as a natural fertility doctor, that can actually mean a lot of things. One, have you vetted the clinic well enough? So I talk to a lot of my patients about how to find a good IVF clinic for them and what kind of questions to ask. And two, did you have to jump to IVF right away? If you wanted to, that's your choice, absolutely. But were you told that IVF was your only option and then no one gave you any other choices? That's kind of what I mean by that initial question. So let's dive on in. First off, IVF is not bad. As a natural fertility doctor, I feel like people just think I hate on IVF, and I am not about it. I have a ton of patients who have done IVF, are doing IVF, are preparing their bodies for IVF. So it's not that I don't believe in it, it's just, do I always think it is necessary? Probably not. I feel like a lot of people are just given one way or the highway, meaning they go to a fertility clinic, they get worked up, and they're ultimately told that IVF is their only route of success when it comes to pregnancy. And I just don't think that's true majority of the time. There are those cases that definitely need IVF. You know, if you don't have fallopian tubes or both fallopian tubes are blocked, maybe even azospermia or basically zero sperm. But even in cases of that, I've actually helped couples come back and conceive naturally. There just needed to be some fine tunes and adjustments when it came to diet, health, and then some herbs and supplements added in. I feel like this can actually be a really long video, and when I was preparing for this, I was kind of like, oh, this is gonna go so quick, but as I'm talking, I'm like, there's so much to be said. Ultimately, I'm just here to say that I am not against IVF. This is just what I feel like needs to be said, and not a lot of people are able to hear it because they're just pushed down this conventional route of fertility care. So here we are. You're obviously here listening to me because you do like more natural remedies, more natural ways of things. So how does this journey start? For most people, it's that they're struggling to conceive. They go to their OBGYN usually first. Their OBGYN does some testing. Sometimes they give them some medicated cycles, so Clomid or letrozole for that. And then usually beyond that, they decide to send them to a reproductive endocrinologist or an RE, as I'll probably refer to them throughout this video. If they get that referral to that RE, they again do a bunch of tests, probably an HSG, an ultrasound, a bunch of blood serum labs. The list can go on and on. I actually have videos about testing that you can get done. You can check those out on my channel. But ultimately, it's usually OBGYN, RE, and then they make determinations for your next step. Most of the time, couples get told that IUI is a great next step. This is where you usually have either a Clomid or letrozole medication, possibly a trigger shot. Your ovulation is monitored through ultrasound, and then semen is injected through the cervix to basically bypass a lot of those roadblocks that can occur for sperm, and then you wait to see if pregnancy occurred after that 2-week wait. Usually, if those fail a few times, then couples get told that IVF is their next option, and they're usually told that it's their only option. Again, you kind of know why I feel differently about that. I think there's a lot of other things to be done, honestly, even before IUI. I think treating the root cause is really important. I think gut health issues play a big role, and those never get tested by reproductive endocrinologists or OBGYNs. I think thyroid's a big player. When it comes to thyroid, we checking your antibodies, your free T3, your free T4, and I think a lot of practitioners check that once now, but they don't continue to. And if there's signs that there is a thyroid struggle, then that's important to continue checking throughout your entire journey. Insulin levels, checking micronutrient levels. Basically, there's a bunch of other things that we can test for depending on signs and symptoms of what you and your partner are going through, but those are just kind of a few things. So again, gone off on the tangent of finding the root cause and treating it, but I just feel like I have to say that because that's who I am and that's what I believe in. Okay, but say you get to the IVF route and this is what you want to do, whether you're getting accompanied by a natural practitioner like myself, or you're just ready to do that right now and you're like, this is the course we're taking, what do I do from here, right? Like, what are the questions that I ask? How should I get myself educated enough to go into that clinic and be able to ask questions that are going to be advocating for myself? So I'm going to give you a list of questions that I think should be asked while vetting out IVF clinics. Actually, before I do that, I'm here to remind you that getting into a reproductive endocrinologist office can take a lot of time. So if you're not sure you want to do IVF, but it's been recommended for you, I highly recommend just getting on their list. It can be anywhere from like a week to like 6 months booked out. So I would just get your name on there, get an appointment. It doesn't even hurt to get that initial consultation and to be able to get in with the practitioner and to ask these questions. That could be a really good just first start, and you don't even have to make that commitment yet. You can just be like, you know what, like, before I start, I just want to learn as much as I can. So I highly recommend that, because at the end of the day, they're going to be redoing a lot of different tests, right? So that's going to take time, and then you have to prep your body for egg retrieval, and then you have to prep your body for the transfer. So there's a lot that can be done. Again, on my side of things, we can also help support. So the sooner we also know that you're gonna go through IVF, we can start prepping your body for that as well. I feel like I keep going on tangents, but let's circle back to these questions. So what is the first question that I would ask an IVF doc? One, it would be like, who am I gonna do most of my communication with? Because I could be feeling really comfortable with you as my physician, but who am I going to be talking to the most? That's gonna matter, and I really need to have a good relationship with them, because that's gonna be who I spend a lot of my time and energy communicating with. The second question, what types of treatments are available? So a lot of people don't know this, but there's a decent amount of ways IVF treatments can be done and performed. I'm not gonna go into the details of all the different ways IVF can be done. Essentially, there's like very conventional methods, and there's a little bit more natural. There are people who are also trying more, I don't wanna say experimental, but kind of more experimental side of things, but are technically on the more new cutting edge side. And then there's the people who are more tried and true. So at the end of the day, it's kind of like, where do you fit and what are their options for you? And do they have different types of options? Because I think that's important to know. I feel like when you go into a clinic, most couples just tell me that they're told one way to go about it, and it's nice to know there are different options. The next question is, what is their success rate? So unlike where the practice like mine, where it's really hard to determine success rate, in my opinion, IVF is a little bit more standardized, and so most of those clinics have a very clear success rate, and their practitioner should know that. How many cycles on average does it take to actually conceive? So some couples that I know have told me one of their biggest issues with the IVF clinic was that they were allowed to believe that like this was a guarantee to have a baby, and then when it didn't work, they realized it wasn't. That was so sad to me, because they thought that they were spending all this money and their time, and at the end of it they were guaranteed a baby, and when in fact they weren't. So just knowing that it could take multiple cycles is one, important, so I'm trying to share that with you today. But two, also knowing how many cycles is the average is just going to be something that's nice to know, and could also tell you about, you know, the quality of the clinic. Asking if they can give you a financial breakdown. Are there payment plan options? What are the different types of options? Are different types of IVF transfers going to be more expensive than others? Just letting you know the actual breakdown. Do you guys take insurance? Do they not take insurance? All these different things. At the end of the day, we know that infertility can impact mental health, emotional health, but also financial health and wellness. So it's going to be really important to get that information up front so you know what to expect and you're not blindsided. Asking them if there are other options outside IVF, see what their response is, especially based off your case, seeing what their ideas would be if IVF were to fail. So what do I do if this fails? Knowing that there is a plan and for later on can also be really helpful. Or you can see like, oh, they don't have a plan for me for later on. That can be something you can consider while, you know, picking an IVF clinic. And then obviously it might be biased, but how do they feel about natural treatments and remedies being used while going through this process? That can be my type of medicine, you know, diet, lifestyle, herbs and supplements, acupuncture, visceral manipulation, all those types of things. Ask how they feel about it, because if those things are important to you, that's going to be good to know that they either support that or not. I will be totally honest with you, I do have couples that I work with that their clinic supports it and their clinic doesn't. They're ultimately operating from like a this is my body, my choice situation, and as long as it's not dangerous to them or future baby or future possible baby, they're fine doing the natural treatments. Obviously, this list can go on and on. There are so many different questions that you can ask. A lot of times it does go case by case, and it is something I actually do with my patients. Is I help not only prepare their body, but I talk to them about their specific protocol that they've been given from their RE, and we go over questions that they could ask them, and we just make sure that they feel heard, seen, and they can understand what's going on, you know, with their body, because ultimately I feel like sometimes there is a barrier there, and it's one that I'd like to break down. So I hope you learned something from this video. If you have any questions or want to work with me one-on-one, I have all my information linked down below. Please give this video a thumbs up if you liked it, if you learned something new, and don't hesitate to add questions that you would want to ask your IVF clinic in the comments below, because ultimately someone can learn something new and those questions could help someone else going through this journey as well. So thanks for being here, and have a beautiful rest of your day.